For most of human history, the internal body was an impenetrable black box. When falling ill, our ancestors attributed pain to unseen forces. But humans are exceptionally fragile. Our ancestors were forced to confront the terror of the unknown because bodies break, bleed, and fail. This is the earliest archaeological proof of surgery, prehistoric trepanation. Healers used sharpened flint to scrape a hole directly into a living skull. Remarkably, many specimens show bone healing around the opening, proving patients actually survived these invasive procedures. That survival represents a major milestone. Thousands of years before the rise of scientific medicine, the necessity of healing had already driven humans to perform invasive operations. Ancient Egyptian healers began meticulously categorizing injuries, detailing treatments for wounds, fractures, and dislocations. While they developed specialized instruments for these procedures, they almost never attempted to open the abdomen or chest. In Mesopotamia, surgery evolved from a mystical ritual into a strictly regulated profession. For the first time, a healer's skill was tied to a legal framework of responsibility. This basalt stele contains the Code of Hammurabi, which set a high price for successful surgery, but a terrifying penalty for failure. If a surgeon performed a major operation that resulted in the death of a high-status patient, the law permitted the surgeon's own hand to be cut off. Early surgical progress was not only limited by a lack of anatomy, it was suppressed by a society that made operative failure a life-altering crime for the practitioner. Ancient India produced some of the most sophisticated surgical traditions. Indian physicians approached the body as a complex physical system that could be systematically repaired. The Sushruta Samhita, a major medical text, describes an arsenal of over 120 steel instruments. It included scalpels, specialized sharp trocars, and magnetic tools used to carefully remove metallic foreign bodies from the flesh. To master these tools, students practiced on inanimate objects, making incisions in pickles or lancing leather bags filled with material. This established a tradition of surgical simulation long before operating on living tissue. This allowed for early reconstructive plastic surgery. To replace a missing nose, surgeons cut a flap of skin from the forehead. By rotating the tissue while keeping a portion attached, they preserved the blood supply. This ensured the graft remained healthy. This successful rotation of living tissue demonstrated that the body's structures could be surgically repositioned and integrated without losing their vitality. In Alexandria, the study of the body took a massive leap forward when physicians were legally permitted to perform human dissections, allowing them to map internal structures with unprecedented accuracy. This anatomical mapping led to a major technical breakthrough in ancient surgery: blood vessel ligation. Ligation involves physically tying off a bleeding vessel to stop hemorrhage. By controlling the blood supply, surgeons could finally perform major operations like amputations and hernia repairs without the patient immediately bleeding to death. Roman surgeons inherited these techniques, using specialized bronze instruments to clamp vessels and manipulate tissue. Surviving tools from Pompeii show a high level of mechanical sophistication and variety. The physician Galen used the trauma of gladiators as a window into the human nervous and vascular systems. However, because human dissection was restricted, he relied on animal anatomy, and his resulting errors would be taught as fact for 1,000 years. By the end of antiquity, humans had mapped the major internal organs and developed the first reliable ways to stop surgical bleeding. But this momentum was about to be interrupted. When the Western Roman Empire collapsed, the infrastructure for organized medical education disappeared. In Europe, surgical knowledge began to fragment. Medieval church regulations eventually prohibited the clergy from performing surgical incisions. This created a profound professional divide, separating university-trained physicians from the craftsmen who actually performed operations. Surgery became the work of barber surgeons, men trained through apprenticeships rather than books. They performed bloody, localized procedures like bloodletting and tooth extraction, using only crude sponges soaked in opium to dull the pain. By separating the study of medicine from the practice of surgery, the intellectual progress of operative care was nearly halted in the West. However, the surgical blueprints of antiquity were not lost. Scholars in the Islamic world translated and expanded upon Greek and Roman medical knowledge, while Europe remained in retreat. The surgeon Albucasis produced the first illustrated surgical manual, documenting procedures for everything from eye surgery to the manipulation of spinal deformities. His work ensured that these ancient techniques were preserved and organized. These texts eventually flowed back into Europe through medical centers like Salerno, reconnecting the West with its own surgical heritage and the advancements made by Islamic scholars. This journey reveals the four main barriers to modern surgery: anatomy, bleeding, pain, and infection. By the late Middle Ages, surgeons had made measurable progress in understanding structure and controlling blood, but the final two walls would stand for centuries longer. To treat the living body, we had to systematically document its hidden structures and learn to control its most vital systems. We are the first species to turn the study of its own physical fragility into a specialized scientific craft.